abolish borders, abolish ICE, abolish prisons, abolish the police, abolish the United States Senate. This is well outside the bounds of normal political discourse, and it's all happening, in the Democratic Party. Extreme positions are becoming the mainstream positions, including this anti-Israel, anti-Jewish rhetoric, which has infected all of these primaries out there.
Last word.
Well, I mean, the fact is, though,
they're running on absolute and total radical anarchy that is antithetical to the American.
Let me ask you a point of clarification. Do you think Medicare for all is socialism?
Welcome to Political Crossfire, where we break down the fiercest political debates and examine the facts behind the headlines. Jake Tapper and Scott Jennings just went head-to-head on CNN's State of the Union in a heated debate over Medicare for all, socialism, progressive Democrats, the Democratic Party, and the future of American healthcare. Jennings argues that Democrats are being pulled toward radical socialism, but Tapper cuts straight through the rhetoric with one simple question: is Medicare for all actually socialism? So watch this exchange closely. We're going to break down what Scott Jennings gets right, where his argument starts running into trouble, and what this debate tells us about the growing fight over progressive politics in America. And if you enjoy heated political debates, subscribe to Political Crossfire and help us grow. Let's get into it.
Sanders of Vermont last night in Michigan campaigning with progressive Senate candidate Dr. Abdul Al-Sayed, who we had earlier on the program. My panel joins me now. Congresswoman Kelly from Illinois, so you have a sense of what's going on in the Midwest. Bernie Sanders there very clearly suggesting that establishment Democrats are not the key to change. These progressive insurgents are. What do you think?
I think it depends on who we're talking about. Like Diana DeGette just lost, and she was one of the founders of Medicare for All. Just because you've been there a long time doesn't mean that you're not progressive or you're not doing what progressives want you to do. I think that it seems like experience, because you have experience, that makes you established, and some people don't want you, but not everybody, of course.
Corbin Trent, co-founder of Brand New Congress, co-director of Justice Democrats, former communications director for AOC, just in case the folks out there aren't sure who you are. I suspect that you have a different view.
I mean, I think that, just because you were one of the original supporters of Medicare for All, we've gone a long time trying to get things like that passed. I think, people are looking for results, not just your indications of what what you stand for. They want to see change, and I think that we've gone decades and decades without it, not going in the right direction at least, and I think that's the key.
Republicans went through something like this about 15 years ago.
With the
rise of the Tea Party movement, and what that led to were, in some cases, folks running who were taking on, the establishment favorites who won and actually have become really strong members of the United States House and Senate. Marco Rubio being a great example, not endorsed by the D.C. establishment, but took it on anyways and won. But then there were lots of other instances of somebody running, defeating a more establishment candidate, and then it sort of throwing the election away. And I do think the Democrats are at risk now in a variety of seats. I mean, you saw this now, it's happened in Maine, where Susan Collins is now not as vulnerable because of all of the disaster happening there. This could be the case in Michigan as well. If Democrats nominate someone from the more extreme wing of the party, that could lead to a less favorable environment for them, even in a moment just like in 2010 for the Republicans. Great election for the GOP that year, but did they leave seats on the table by still having nominees?
I think to boil this down to just insurgent versus establishment overlooks what many of these people are running on. They're simply beyond insurgency here. I mean, you've got people out there winning primaries that want to abolish borders, abolish ICE, abolish prisons, abolish the police, abolish the United States Senate. This is well outside the bounds of normal political discourse, and it's all happening, in the Democratic Party. I don't think the Democratic Party leadership understands they've already been overwhelmed, and it's just a matter of time before these views become the mainstream platform, and that's what they're going to end up running on in 2028 as well.
I think we do understand. We talk about it all the time in the Democratic caucus. We know we're a big tent caucus, and that we're not all going to agree, but the one thing we agree on, we know we have to win. And that's what we're concentrating on.
To do these things that they're laying out in these.
No,
I know I know you probably don't agree with.
We cannot go back to business as usual, though. It wasn't perfect under us. We know we need changes. We know we need health care for everyone. We know we need better education. We know we need better housing, and we have to do all those things.
Do we need police? Do we need prisons? Do we need border enforcement?
You don't hear most of us saying that. Yes,
and
we need
the
police,
fact is, though,
but not in the same way that ICE is doing it.
I mean, the Tea Party for example, it came out. It wants to abolish the Department of Education. It wants to abolish.
So did Ronald
most
Reagan.
of
They
the-
want to
most of the
abolish
So did
that now.
Ronald Reagan.
Abolish this, abolish that. Privatize Social Security. Put that in the stock market and see how it does. If it crashes,
Would have
that's
done
your
great
problem.
had they done it back in
Yeah,
05.
until it doesn't, right? Until it doesn't, which is what happened in the 1930s when people were struggling. And I think that's what we're seeing right now is a moment sort of like we had in the 1930s in America, where people are tired of the way things are going for them, and we're going to see a transformation in the way our politics is done, and hopefully we'll see a Democrat.
I agree. The
trifecta.
anti-Israel, the anti-Jewish rhetoric, it does remind me of the 1930s. I couldn't agree with you more.
There is no question that the anti-fascism is also rising, and the fascists were on our shore back then. And what we're committed to now is fighting what? Socialists? I mean, the idea of having
Yes.
health care that everyone
Communist,
can.
socialist, very
Are they the same
antithetical
thing
to
or
the
are they
American
different? Are they the
system.
same or are they different? Because I think socialism.
Scott, your party tried a coup, tried stealing the election, and incited a violent insurrection. Would you say that is antithetical to the American system?
TVA, where I'm from, East Tennessee, was built by socialism. The TVA was built by it. Oak Ridge was built by it. Factories were built by it. Alcoa was
Built by
it.
socialism?
America, absolutely. Government workers, 90% of the people that built those
Having a
dams,
government is
that
not the
built
same
those
as having
things.
socialism.
Well, so if it's not the government doing the work and the government building things for the people and then keeping ownership of it, if that's not what socialism is, then what is it? You tell me. If it's not direct employees building the
So
New
you're
York City
saying
subway-
you're saying any level of or any
I'm
amount
not.
of
I think
government
your
is
people
socialism.
are. I think your guys are actually. I don't.
We're not the
you're
one
the ones
running
that
on
label
it.
all this stuff.
You
communism.
have a whole faction of your party called Democratic Socialists of America who are running on things well beyond basic government services. They're running on absolute and total radical anarchy that is antithetical to the American.
Let me just ask you. Let me ask you a point of clarification. Do you think Medicare for all is socialism?
Well, I think if the government overtakes an entire sector or entire industry, that's the proposal, that would be socialism, absolutely. And there are countries around the world that engage in socialist practices where they have taken that over, and the outcomes for those people in many cases are terrible. But it's a legitimate debate. Are we going to have the government running entire sectors of our economy, such as healthcare? Conservatives don't believe in that.
And we took a look in some polling that I did just this past week about Medicare for All because we know it's going to be more of a topic of conversation, especially as more of these sort of very progressive folks win in these primaries. What a lot of voters say is they say, great, if we can do it by taxing the rich, that's wonderful, but don't you dare raise taxes on me. And I think this is where, for some of the folks in the DSA sort of movement, when the rubber hits the road, that's where this friction on the Democratic Party comes along, where the establishment says, that's nice, but we've got to do stuff that actually works. And they still may get overtaken by people who say,
What are you
nope, we're just
talking
going to
about?
say fight, fight, fight.
The current system we have right now,
She's talking
$72
shit.
trillion is what it's going to cost us over the next 10 years. Our current healthcare system, $72
Called
trillion.
Obamacare, by the way.
But you're talking about
it's
all the
current-
health insurance,
all
and
the health
agencies,
insurance,
hospitals, everything.
Everything.
Yeah.
The entire thing is going to cost us. That's an unsustainable, and that's not even covering every American. That's the current system.
So let me ask you a question, Congresswoman. Medicare for all, it seems like that is about to become, if not already has become, the Democratic Party platform. Is that fair to say? Does that get rid of insurance companies, or does that just provide like the public option as they used to talk about with the Obamacare?
You know, as was just said, it's been around for a long time and there's different iterations, but I think that it's going to be the foundation of what we do because we still don't have health care for everyone. And in the richest country in the history of the world, we need it. I was going to say, my husband, we were in Canada. He got sick. He was in the emergency room 3 days. His health care bill was $800 for 3 days. And then you could not do that in the United States of America, being in the emergency room 3 days and only $800. And he received very good treatment.
I think describing the Canadian system where people wait weeks and weeks or months and months and months for
wait.
very basic healthcare procedures. You do not want that here. I promise you. We have the best healthcare system in the world. We have the best doctors in the world. To force people into a system where they got to wait months and months and months to get a knee surgery.
They don't even wait here, Scott, because they don't even try to go.
You have to
That's
wait.
not true.
But you have to
People
wait
get knee
here.
surgeries here all
you
the
have to
time.
wait here also. And my husband, he's not alive anymore, but he was a doctor.
Yeah.
So I know.
How does this stuff poll with the independent voters? Like, how much is the DSA platform? Well, let's not take the most extreme members of the DSA area and talking about no borders, no jails, et cetera. But let's just like Medicare for all, or more taxing of the rich. How does that play?
So those two things test very differently. Taxing the rich is something that you even find some folks on the more conservative side of the aisle being a little bit more open to. Donald Trump, just people who are all pure sort of economic conservatives of days gone by. So there are different pieces of that poll differently. But there is a lot of stuff that is very far left that is not where independents are at. Do they want someone who's an outsider? Yes. Do they want people who are going to fight? Yes. Do they want them to fight for checking the box of everything that the far left wants? Absolutely not. And that's what I think is leading to Democrats having this political environment that's really favorable to them. When you're the party not in power, you got the wind at your back. And if they choose candidates who are way far out there, they're going to throw away seats that could have been available to them.
You can't have this conversation without talking about, you wanted to exclude the extreme positions. The extreme positions are becoming the mainstream positions, including this anti-Israel, anti-Jewish rhetoric, which has infected all of these primaries out there.
Last word.
Well, I mean, the fact is, though, that I wrote a piece called How to Sell a Tractor, right? And from East Tennessee, when I'm selling a tractor, if I know that I want $15,000 for that tractor, I don't start off asking $15,000. I ask 25 maybe, or 18. Then I work my way down. So you have to have a position staked out a little further than where you want to end up. So I think far left is good.
All right, everyone, thank you so much. Really appreciate it. Great conversation. On Thursday night...
Here's where I think Scott Jennings' argument runs into trouble. You can call Medicare for All socialism as many times as you want, but eventually you have to move past the label and answer the question people actually care about. What system gives Americans affordable health care without financially crushing them when they get sick? Because right now, Americans already spend an enormous amount on health care. People pay premiums, deductibles, co-pays, prescription costs, and taxes, and millions can still end up delaying treatment because they cannot afford the bill. So when Jennings says America has the best healthcare system in the world that deserves a follow-up, best for whom? Having incredible doctors and hospitals doesn't automatically mean you have the best system if millions of people struggle to afford access to them. And I thought that was the most interesting part of this entire discussion. Jennings warns about government involvement as though public investment itself is somehow foreign to America. But Social Security exists, Medicare exists, public schools exist, highways, infrastructure, rural electrification, and decades of publicly funded research exist. America has always had a mixed economy where government and private enterprise operate alongside each other. That doesn't suddenly make the United States a socialist country. And Corbin Trent made another important point when he brought up the estimated cost of maintaining the current healthcare system. Because opponents of Medicare for All constantly ask, how much will it cost? Fair question. But then we should also ask, how much does doing nothing cost? If the existing system continues consuming trillions while Americans still face medical debt and struggle with afford, defending the status quo simply because the alternative has been labeled socialist isn't much of an argument. Now, none of this means Medicare for All is automatically the perfect solution. There are legitimate questions about taxes, implementation, private insurance, government efficiency, and how such a massive transition would actually work. Those questions deserve serious answers. But that's exactly the point. Let's debate the policy. Let's debate the numbers. Let's debate whether Americans would ultimately pay more or less and whether healthcare outcomes would improve. What we shouldn't do is throw the word socialism into the conversation and pretend the debate is over. So I want to hear from you. Is Medicare for All really socialism, or has that word become a political scare tactic used to shut down a much bigger conversation about America's healthcare system? Let me know what you think in the comments. And if you enjoy these political debates and breakdowns, subscribe to Political Crossfire. I'll see you in the next one.